apologies for absences first?
Yes, of course. I'm just going to wait until we receive notice that the recording has started, and I can just confirm I've gotten that.
Thank you.
Bear with me just one moment, Councillor
My
Mans.
apologies. Kevin, can we...
Not to worry, we have apologies. Sorry, it'll be me today, no Kevin.
Right, yes, so we can start the recording first.
It has been started.
That's good.
We have received apologies from Councillor Barbara Beardwell, and David Kelly is here standing in for her, and Carolyn is standing in for John Coughlin.
And no other apologies at all?
No.
Fine. Okay, well, I just have to, I think, read out this statement about welcoming you to the meeting. This meeting is being held remotely and members are in attendance via video conferencing. The meeting is being live streamed and will also be available for repeated view. I'll begin by naming the members who are in attendance for the public record. During the meeting, members may wish to speak. They will indicate this to me and I will then call them in turn. And I'd also like to remind members that County Council standing orders still apply, so please keep your microphone muted unless you've been called to speak, and that you may be visible on the screen to the public, to other members, even when you are not speaking. Okay, that's the standard start to these meetings. And then I better just check who we've got here in attendance. We've got Councillor Ken Rattican. Welcome, Ken, from Basingstoke and Dean. We've got the Executive Member for Public Health, Judith Gradesky, the Executive Member for Adult Services, Councillor Liz Fairhurst, and we've got, who else we got? David Kelly, obviously, our legal advisor, Judy Gillard, and we've got Laura Taylor in attendance, and we've got Councillor Patricia Stallard, Executive Member for Children's Services. And I think that's it, as far as I can see. Okay. Samara, I've forgotten you, Samara. We've obviously got you in attendance as well. Right, let's make a start. And of course, we've got Simon Bryant, who is now going to, before we move on to his outbreak report, we just need to make sure that we've got no declarations of interest of any sort. I don't think we have. And we've got the minutes of the previous meeting. You've seen those. Are you happy that those are an accurate record of the previous meeting? You don't need to put your hands up or indicate unless you feel they aren't. So if you do nothing, I accept that as you're in agreement. So are you in agreement with the minutes being passed? I'm not aware, Samara, of any deputations.
No, there are none today, Councillor Mans.
I've got no specific chairman's announcements apart from welcoming you all, and obviously to say that we're now in the stage of the pandemic where there are indications that there is an increase both in the numbers testing positive and also a small rise in the number of people in hospital. But I would like to add that, as Simon will tell you in a minute, the actual rate of increase and the numbers in Hampshire are still below the national average and not nearly as high as some of the areas in the north and the northwest. But we are in a position we've got to start thinking of the sorts of plans. We need some contingency plans of what we will actually do if the rate in Hampshire continues to rise until it gets to a level where we have to start taking action. But I'm going to stop there, and I'm going to go straight over to Simon now to give us the outbreak control position report, which is the main part of our meeting this afternoon. Simon, over to you.
Good afternoon. Sorry, struggling with the pressing 15 buttons at once. I'll give you a short presentation on the data to start with. This presentation, as part of a presentation I gave this morning, give a little bit on the data. So just to give an update on the actual figures. So in the last 7 days in Hampshire, we've had 76 new cases. That brings our total to 5,658. And the 7-day rate average, this is really important, shows kind of growth in the 7 days, is 9.3 per 100,000. And that is below the South East average of 13.7 and well below the England average of 34.1. I'll just add a little note of caution with those figures because the testing capacity is very stretched at the minute, and I'll talk a little bit about that later on. But I think it's encouraging below the South East. However, I think those figures are an underrepresentation when you look at other indicators, as Councillor Mann's mentioned, beginning to see a few more hospital admissions come through, still in the single figures, but below previously they've been, 1 or 0. So we're beginning to see that rise. And there's an Office of National Statistics surveillance survey, and that also is beginning to show a rise in the South East. So we're really cautious and really aware of the kind of where we are in the figures. So if I give you the weekly update, it comes out kind of semi-regularly on a Friday, but we are absolutely tied to the timelines of Public Health England, so sometimes the data comes out over the weekend. But if we look at this graph here, we see the first peak as we saw, and then we can see beginning to see on the right-hand side of the graph those figures rising. And previously would have seen the kind of the last 4 or 5 bars increasing a bit, but we're not seeing that data at the minute because it's leveled off due to testing, but that gives that figure there. And I'm always very impressed with my team. They always put the right logo on the bottom, depending what the national thing is. So hands, face, space is this one. So, and again, we can see that little rise, England's gone right up there, and we can see a little rise in different districts, in the last few weeks. Again, just reminding you that some of the reasons that Basingstoke and Rushmore are higher is because they did good testing at the beginning. What's really important to look is the slope at the right-hand side. So if the slope is going up on the right-hand side, we just need to keep an eye on that. So, yeah, we can see it slowly rising across Hampshire, and then more steeply in England, really led by Leicester, Oldham and Manchester and places like that. So when we look at infections and number of cases per 100,000 across England, on the right hand side we've got throughout the whole pandemic, it gives you that indication. On the left hand side you can see week 37, so the most recent week that we have, and you can see there that actually Hampshire is a lovely light blue colour, but we've got that red spot for Swindon, and then we've got some yellow for Surrey, and there's been some increases in certain parts of Surrey, not near our border, but it's just worth watching it. But we are beginning to see cases around about at the edges of Hampshire going up, so we just need to keep a really close eye on that, mainly the ones nearer London. And then just thinking about those on the watch list, is it really helpful just to give that kind of national perspective of where we are. None of our areas are on the watch list, but you can see around there that the numbers are increasing, and that's northwest in the main, that kind of area there where they've got lots of cases that they're managing, and then the enhanced support in the dark blue, and then those areas concern in the lighter blue. So again, we're not on any of those lists, and that's very positive for our situation. And then finally, just looking at deaths, really important just to monitor the impact of COVID on death rates, and you can see back in the middle of the graph the excess deaths there, but actually this week there have been no excess deaths, and we can see that's right down and lower than the 5-year weekly average, so that's really, really positive. Again, linked, we know that as the number of cases and the number of hospitalizations go up, deaths follow a little bit later on a lag, so again in a really positive position. I will start presenting on the data there. It's worth giving a few updates. So on testing, I can say that we have been challenged on the ability to test due to the national lack of lab capacity. And that's really important to understand. So what that does is each day the testing centres have a kind of cut off, so they can't take any more tests through that day. So people are, as you've heard in the news, are struggling to get tests. So we're doing all we can to improve that, but that will affect our figures. Councillor Mann, so if I pause there, because I think the next part of the agenda is what action I've taken. So if I pause there on the figures, and then I can move formally on to the next part of the agenda, or happy to move straight into that if that's helpful.
I think probably it's a good idea if we pause there to ask if anyone has any questions, and then we'll just simply come to the recommendation, which is to note the current data and implications. Questions, Judy?
Yes, thank you very much, and nice to meet everybody. I just wanted to ask, what is the age range across those cases? Because I'm hearing nationally that we're getting much higher numbers of young people, and I didn't know whether that was reflective in Hampshire, because I think that's quite key when we're looking at the work that we're doing in nursing homes to support nursing homes.
Yeah, absolutely, Judy. So what we've seen in this part of the pandemic is that the cases are in younger people. Between the previous board and this board, we had a number of travellers coming back from places like Greece and Croatia. A little group in Winchester caused a little bit of a spike, I suppose you call it there. And then there was a group in, we had a house party in Andover of younger people. So that's what we're seeing. And that does mirror what happened abroad in terms of France and Spain, and then it kind of moves into that older population. So it's really important. However, we need to be mindful that in that younger population, the doubling rate, so the number of times it takes to double, is months, as in a couple of months. Whereas in older people, it's much, much shorter, it's down to weeks. So again, when it is in older people, it spreads quicker, but we're having more cases in younger people.
Thank you. That's helpful. Thank you.
Can you just explain why it takes longer to spread amongst younger people rather than older people?
I suspect, and I'm just kind of doing my scientific public health knowledge, I don't know why in this particular case. I suspect it's due to the vulnerabilities of older people and their underlying conditions, so they're more likely to catch it, and just the way that it's working. I don't know why that is. I can do some investigations, but I
it's just I haven't heard that said before in that way, and I think it's a very interesting point because we realise older people generally are more vulnerable and can have a greater percentage chance of having a more serious illness, whereas young people can quite often, as I understand it, almost have it without realising it. But I hadn't quite picked up the point you were making about the fact that it is transmitted more slowly amongst young people in terms of passing it on to others, whereas amongst elderly people it moves more quickly, which of course would certainly to some extent explain the rate of increase of cases in care homes during the first wave of the pandemic.
And if older people are more likely to have symptoms, that might show that, whereas young people might not get tested because they haven't got symptoms. So there's kind of a number of factors there.
Yes, yes. Liz? Microphone. Microphone, Liz.
Sorry, Councillor Manns.
That's all right. I'm doing it all the time myself.
Saying that hospitals have been asked to make space within the next 2 weeks, and nursing homes had to start taking people in from hospitals. I've noticed Graham's here, and I'd like to ask Simon why he thinks in a fortnight's time we're going to see this vast influx. But I'd also like to ask Graham, with your permission, we have Woodcote in the south of the county, but I just wondered if Forest Court and Willow Court are going to be ready for this output from the hospitals, and whether we have been asked to do such.
So yes, I did see that article in the paper. I have to admit I'm not so close to what the NHS has been asked to do. However, I wonder if that's a national decision, because I suspect in the north of the country they're struggling a lot more with hospitalisations. As I said, our numbers are certainly less than 10 in hospitals, so we're a little bit down the line from that position. but I expect soon we'll be moving that direction. So I haven't seen the direction from the NHS. Graham may well have done, but I will certainly keep an eye on that.
Graham, do you want to comment on that?
Yes, by all means. So what we're seeing largely across the southeast at the moment, in terms of the acute hospital occupancy levels, they're standing across the southeast at around about 88%. And that's a consequence clearly of acute hospitals and the NHS having moved into restoration. So through the course of March, April and May, a significant amount of surge capacity was created on the basis that people would need to be admitted into acute hospitals because of COVID-19. Over the period since July, the NHS has been moving towards recovery, and certainly in terms of needing to ensure that those people who've been waiting for elective care can be progressed and back into the system. So that's why we're seeing overall occupancy in acute hospital sites rising. There's some variation locally in terms of that 88% occupancy figure. I believe University Hospital Southampton is standing around about 92 to 93% occupancy. In terms of the move, what we're starting to see again is a measured and well ordered starting to prepare on the basis that we've seen the rise in positive COVID in other parts of the country. Whilst we're not seeing that locally at this moment in time, clearly we're going into winter, which is a time of increased pressure generally across health and social care. We've got measures that have been underway now since the beginning of COVID in terms of new ways of working across the health and social care economy. And all of those measures are working in a direction to ensure that should it be needed, and as elective care within the NHS is being restored, there's sufficient capacity should we see an uptake in terms of COVID cases that require hospitalisation. Just to underline though, we're not there, we're not seeing that, but there's something about planning for the worst and hoping for the best in terms of making sure that we're all collectively attentive to that. In terms of Councillor Fairhurst's question around discharge to assess facilities, we've got specific capacity that's been stood up in the southeast of the county in a facility known as Woodcott Lodge. It's a dedicated facility which is being funded by the NHS but provided by Hampshire County Council. And what it enables is for those people that need onward support in a bed-based capacity, who would otherwise perhaps be discharged to a range of care home settings, to recover and be supported for rehabilitation and enablement. In order to keep care home populations safe, people are being discharged into a dedicated discharge to assess facility, Woodcott Lodge in southeast Hampshire, and that is enabling us to support those people to recover, hopefully gain independence, but also be in a COVID safe environment in terms of quarantine and making sure that we've got dedicated care regimes there. We as a local authority are also standing up similar provisions in the north of the county at Willow Court, which is an existing Hampshire County Council care home, which is moving over to entirely dedicated discharge to assess capacity. That is in a position where it's able to start admitting people from hospital settings, where that discharge route is the right one. And similarly, down in the southwest of the county, we've got a care home facility, Forest Court, which again has got dedicated discharge to assess capacity. And again, that is open and will be receiving residents.
Graham, thank you very much for that. I've learnt a lot. I hadn't quite realised we'd done all that. One point, I presume, is that any discharges from hospital are not going to appear in the care homes without a test beforehand.
Absolutely the case. So there is now, I'm able to positively report, there is a very well administered protocol and regime that anyone being discharged from a hospital setting, an acute hospital setting, is having a COVID-19 test before they leave and before the onward receipt. by a care home or any of these dedicated discharge to assess facilities. I must also, though, underline that somebody potentially testing positive before being discharged from acute hospital does not mean that a safe discharge doesn't take effect, because the arrangements we've got allow for COVID positive residents to be discharged safely into these dedicated units where there is safe quarantining and secure measures in place. The last thing we want is for those people to need to be stuck, if I can describe it that way, in an acute hospital bed when they don't need to be there, and actually the care can be provided more appropriately in another setting. And that's typically the case both in the dedicated resources and indeed across the wider care home provision in the county. People can be discharged providing everyone is assured that the best needs of the individual can be met and it's COVID secure and safe for everyone.
Graham, thank you very much. I think that is an important point, because I'm certain the press will look at that and not quite understand the subtlety of what you've said, i.e., although we will be allowing the discharge into our facilities of positively tested inpatients in acute hospitals when they're due to leave, the difference between now and March is that we know they're positive, whereas in March we didn't. Have I got that right? So we can do exactly what you said and make certain that they've got the right facilities outside the acute hospital, acknowledging the fact that they've tested positive to the virus.
Absolutely correct, Councillor Mann. So we saw a direction from government on the 16th of April that people being discharged from hospital should have a COVID-19 test. Prior to that period, we saw some really positive work done in the county of Hampshire. So Hampshire hospitals, for example, were ahead of the game in terms of undertaking tests. But until the middle of April, and indeed subsequent to the middle of April, the nature of COVID-19 in terms of asymptomatic variation, in terms of what people may have had at that time, it wasn't as well known as it now is. So that protocol that I've explained, that all patients before discharge are having a COVID-19 test, is absolutely the right way to go. While
you're still on the pedestal, as it were, just one other point. Testing has obviously been much in the paper. I'm very conscious of the fact that one of the issues that's occurred in the spring was that nursing staff and care workers quite often worked in more than one locality, particularly if they were on a bank or working part-time. Are we satisfied that that category of person is being given some priority to ensure that they do get a test or a follow-on test at certain intervals to ensure that they're not spreading the virus between the different locations they work in?
Yeah, there's a great deal of work that's been taking place jointly across the local authority, but very much with the full participation of NHS colleagues from both the CCG, but also from provider organisations, and indeed working collaboratively with the wider care home sector across the county of Hampshire. So what we've seen is the adoption now of weekly tests for all staff in care home environments and the monthly testing of all residents. Now, to some degree, some of the challenges nationally in terms of lab capacity is having an impact in terms of that weekly testing for all staff and monthly testing for all residents. However, across the county of Hampshire, somewhat in contradiction to some of the national press coverage, and this is, of course, is not binary, because there are as many challenges as there are positive stories, but we have seen the care home sector reporting that actually, as the weeks have gone on, they've seen better and quicker returns of regularised testing for their staff in terms of results. As I say, it's not to say everything's perfect. We still need to see that capacity in terms of the lab testing increase. but by and large across the care home sector in Hampshire, we are seeing positive progress being made. There will always be, though, some local challenges around that. We're also monitoring very closely. One of the purposes of government's infection prevention and control grant funding that we received back in May and again in July. And I'm delighted that government have made announcements yesterday that there will be further funding to support the care sector with infection prevention and control. One of the main priorities for that funding is to reduce the risk of staff working in multiple care settings. Without going into the detail of the complexity of some of the challenge that presents, we are seeing good compliance across care providers, but ultimately some types of more specialist staff, because it's a finite resource, will need to work in multiple care settings. Nurses, for example, in nursing care provision, there aren't enough nurses for any one care home to only have its nurses, and there's no risk of them being used somewhere else. Portability across the system is a factor that's with us. But in terms of the testing regime, the more robust that gets, the more confident we are that the risk is reduced through transmission through staff working in multiple settings.
Graham, thank you very much for that. Very useful. Ken, sorry I've gone on a long time because I know you've been wanting to say something for some time.
No. I'm happy to wait. It's always interesting to hear different views from the health world. My question is that we've got a lot of stats that have come forward from Simon's report to us. I wonder, will we be reporting on the excess deaths in elective care? People are concerned that COVID has taken the eye off the ball for some of the healthcare needs. And I wonder at some point, maybe not now, but we will get the figures for elective care deaths that have died while waiting. I just ask that because obviously people are concerned both in this borough but in other boroughs too.
Shall I come back on that one, Councillor Mann?
Yes,
So I think, in the graph that I presented on excess deaths, that did include all excess deaths rather than just those from COVID, and we need to keep an eye on that, and that's going to be, obviously we can't do that piece of work quickly because we need to make sure we look at deaths over a longer period of time. And I know the NHS has looked at the waiting list and those people on the waiting list and the outcome, the negative outcomes they may have experienced. So I do know they're doing that. I wonder, Graham's got his hand up. He may want to come back in on that aspect, but we're looking at it.
Graham.
Yes, thank you. Really good question. Earlier this week, we had a meeting, a Health and Adult Social Care Select Committee, and there was an update in terms of particularly the care home sector, but excess deaths, of course, go across the whole of the county of Hampshire, not only care homes. But what I reported there was that in total since late February, we've seen around about 800 excess deaths to date across the county of Hampshire in our care homes across Hampshire. So around about 13,500 care home beds, and we've seen around about 800 excess deaths. Of those 800 excess deaths, around about 470 have got a direct causation through COVID-19. So the balance, around about 330 by my maths, are for other reasons. With another hat on, I chair the Hampshire Safeguarding Adults Board, and we've commissioned a review into excess deaths so that we can, with health partners, but with other partners, really get under the skin in due course. So I'm afraid it's not going to be a quick undertaking in order to get under the skin of it, but it's a piece of work we've already commissioned. And furthermore, we've also commissioned a piece of work to do a similar exercise, but to some degree it will give us greater granularity in terms of excess deaths within Hampshire County Council care homes. You'll be aware we've got around about 16 care homes as a local authority, just short of 1,000 beds. And we're running a similar exercise, as I say, to give increased granularity to us as a provider of care, but moreover, in terms of that system perspective of excess deaths across the county of Hampshire.
Graham, thank you. Ken, is that all right? You?
I'm grateful for that. If people are dying of cancer, and if that's the, we need to pick that up because they didn't get treated in April or May, and they're passing away now. And people are concerned that relatives are suffering because care was devoted to COVID, and we need to, at some point in the future, be able to tell that story back to these relatives. That's all. Thank you.
I think that graph, which I think you showed us, Simon, with the black line showing what the 5-year rolling average was, is I think a really good one, because the latest figure showed that the total deaths, as far as I could see, and when you showed it to us, is below, the latest figure, below that rolling average for the last 5 years. So that, in theory, Ken, would take into account any deaths that occurred outside COVID, but as a result of it, such as your point about cancer deaths. So have I got that right?
Yes, and I carefully say this, what we've got to be careful of is COVID may have brought some deaths forward by a few months, and that's not right, but that rather than actually, so they may well have died in the next 6 months. And then, so you can need to look at that. We can see that period in the middle of that graph that I showed you, that there was an excess over those months. So there was something going on. But let's look at it over a longer period of time, really understand the impact on COVID on our death rates, including whether that's cancer, heart disease, or COVID, or something else. And as Graham said, we need to do that longer piece of work to understand that.
Thanks, Simon. Judith, sorry you've had to wait so long.
It's all right. I'm staying till the end. Yeah, I think we've had some good news this week from the government in that test availability is increasing, albeit in a fairly linear fashion. It isn't keeping pace with the number of people who are presenting for tests. It's also been good to hear that work is underway to increase lab testing capacity across the country. But we've also heard, disturbingly, I think, but perhaps understandably, that some members of the public are booking tests and having tests without having any COVID-19 symptoms, which means, of course, people who genuinely have symptoms are missing out on tests. And some people are being sent a long way. For instance, I heard, I think on the same day earlier this week, that somebody from Test Valley had been told to go for a test to West Sussex, and on the same day somebody from Haywards Heath had been sent for a test to the Midlands, which somehow doesn't seem very joined up at all. I wonder, do we know how many people in Hampshire are booking and presenting for tests without symptoms, and also how many people from Hampshire are having to travel outside for tests? And how many people from outside Hampshire are coming to Hampshire for tests? Sorry, did you get all that?
I did. So I would love to say yes to all those questions, to say we know the situation. So one of the challenges we have, and we have spoken to Caroline and I with the National Testing League, saying we really need to understand that local granularity. So all the information we have is the number of positives coming out in Hampshire, and then they say 100% of your test capacity was used. Which 100% of what? So because we know that they close the test sites down when the lab capacity is reached. The likelihood of your colleague in West Sussex going up to Birmingham or the Midlands is because they've got a higher rate of infection in Birmingham, so the test centres stay open longer. So actually that's what happens there. It is incredibly frustrating. And I absolutely understand why nationally they want to have control over the part of it, but it'd be really helpful if we could have some discretion on how we manage the local test centres in terms of kind of opening and closing. So if I know that I've got more cases in the New Forest and that's where I need to test, I keep that one open, but I close the one in Gosport just for one day. And we need to work through that. So it is really difficult. We don't know how many people are trying to get on the website, because all we know is kind of the people who failed to get through, but they could try 10 times. So that's 10 people. Well, no, it's not, it's one. It's an awful lot. We also don't know who's symptomatic or not. You can book on the site and basically put any criteria in and get through or not. One of the challenges is, and I think I have sympathy in some senses, that's because the symptoms aren't clear and the message previously had been just get tested, that was the right thing to do. But when you've got a limited supply, we need to change that and nuance that message. And I've been working with Deborah Harkling's team just to really make sure we can promote that message, saying actually only get a test if you need it. It's not helped by people not understanding that, I agree. So with schools, we'll be really clear, look, these people need tests, these people don't. Don't try and get a test if you don't need one, but it is difficult. And sometimes the symptoms can be confused. You know, if you get a sore throat and a temperature, well, you've got a temperature. So technically you need to get a test. Well, we often know that, and it is really difficult for the public to understand that. So yeah, it's not easy, and we're working through that. And as you say, it's encouraging. I was going to talk about in my next piece, the actions we're taking about lab capacity and things, so I can talk about that.
Just quickly to come back on that, is there any form of triage when people book tests to assess whether they need a test?
No, it's all done online. So yeah, as Karen and I were slightly bemused this morning, basically you can say, I'm asymptomatic, I'm not a key worker, in you go. So it isn't helpful. And obviously it's not for people travelling abroad who just need a test to show they're clear. I think Cyprus is a particular country where that's required. It isn't for that, and we need to make sure we use our testing capacity in the best possible way. However, ideally, I wouldn't want to restrict testing at all, because actually that's a really good tool in fighting this and understanding it. But I do understand the challenges you've just given me.
Okay, thanks very much, Simon.
Thanks, Simon. Okay, any more questions at all? Are we happy with the recommendation to note the current data and implications? Put your hand up if you don't agree. Okay, let's move on to 8. Communication engagement update. Simon, over to you again.
So if I think, sorry, my error. I think there's an item on kind of the powers and things. Just to note, I haven't used any of my powers, and we haven't done that in the last, sorry, it might have been combined items.
Right, yes.
Just to give any updates on what, it might be useful just to say what actions we've taken in the last month, just for noting the board. That'd be right if I give a
that's fine.
So with regard to testing, if we started on that, we've been working very, very hard with Department of Health and Social Care, both putting appropriate pressure on them to increase capacity, because it is a problem. We have been setting up local testing units within the county. So the plan is to have 5, and they'll be suitably located around the county, and we're working through that. The regional testing unit that was based at Tipner Lorry Park is moving to Southampton Airport, which is really positive again. That's really central in the county. And as Graham mentioned, the care home weekly testing has picked up, and those tests will be prioritised, and so that's reinstated. If I just move on to some of the preventative activities we've done. We've worked really well with an awful lot of different settings and sites since the last meeting. We've worked with universities. We've done a lot of seminars and webinars to schools, boarding schools and children's homes to really help them prepare for any particular outbreaks or incidents they're dealing with. We've done some tabletop exercises on various different scenarios, including what would happen if there was an outbreak in the university, what would happen if there's an outbreak in a hotel or a different setting. So we've done an awful lot of that work, and that really helps us just to unpick, because if you walk through a scenario, you can then go, actually, I never thought that would happen, or I never thought the hotel would react in that way. So that's been positive, and we've worked really closely with some of our really important sites of strategic importance to make sure they're prepared and we're prepared should anything happen. So in the sense of being prepared, we're working really hard. We're revising our plan with all the new guidance that's coming out constantly, which is both positive and challenging, that the new guidance comes out, we have to revise our plans. With regard to events, we're working really closely with the safety advisory groups in the district councils to make any events that take place in Hampshire safe. We are absolutely, particularly from Monday, but really key with the communication that they have to manage the rule of 6 really carefully, and if they can't do that, we are not assured that they can go ahead. So we are kind of taking that forward. and we're doing an awful lot of work on comms, which I'll come to shortly. I think going forward, as we mentioned in the previous report on the data, we are seeing an increase in cases, so we need to be prepared for that and some of the action we might need to take going forward. So we need to think about, as I just mentioned, are the events safe to take place? And thinking about if events can't be safe, we need to think about what action we need to take. Really promote and encourage, and more than that, really kind of embed the social distancing throughout all our town centres and throughout our communities, both through communications, but also working with the businesses and with our district colleagues to really promote that, to make sure that the places that people go are safe. We're doing a lot of work with, and so we just kind of need to prepare for that. That's what we're working through. So we're doing a piece of work over the weekend, ready for next week, just to look at where we are with the cases, because we know that, as they call non-pharmaceutical interventions, take about 2 and a bit weeks to kind of embed. We're in a good place now. I'd rather pause some events that may take place so that we can carry on in a good place, and also prepare going forward, because we know in the autumn we have some set events in the calendar. We'll have a bonfire night, we'll have Halloween, we'll have things like Christmas market. So we need to be prepared for that now, so that should we need to make any decisions, we do that really early, to be fair to the organisers, but also to be fair to the public, so we're clear. So those are the actions we're taking now, and I'll talk about all the comms messages just shortly.
Thank you, Simon. Sorry, I jumped ahead on the agenda. Any questions on the actions that the Director of Public Health has been taking? Judith. Microphone, Judith.
Sorry, Simon. We heard last week about COVID marshals. Do any of the districts have COVID marshals, and what's the sort of the variation across the patch? And secondly, you mentioned large events. I saw today that this morning that the New Year fireworks display for in London has been cancelled. I just thought I'd mention that, but my question really is about COVID marshals.
If I just start with the easy one, because it doesn't affect us, you're right. Things like New Year's fireworks are being cancelled because we know people want to collect together. So it's actually preparing that really early so that people can think of events in their own setting at the social distance, and I'd rather people were prepared for that now. So that's why I'm sure it's disappointing to hear me kind of mentioning Christmas markets and what we need to do, but we need to think about that carefully. COVID marshals. So I got some information earlier this week on COVID marshals. They're in the realm of a kind of a security guard type, yellow tabarded type role. Again, because we're an area of low prevalence, we're not a priority area for COVID marshals, so there aren't any L patch. The money, there is money for them. All of the South East Director of Public Health pushed really hard and said, please don't push all of this to the areas of high need. We get they're really important, but if we don't act now, we will be an area of high need in terms of COVID. So we haven't got any, and we're just kind of looking into what that role could look like, and how we could embed that in our communities. But we haven't got any at the minute, and as I say, all the money is going up north, but we're seeing what that looks like. And for me, if it's someone kind of like a security guard, they will need some kind of behaviour change skills, because actually to help someone social distance is not just a excuse me, move along, sir. It's much more about having a conversation like the police are doing. And the police and I have talked about this to make sure we're lined up, because they don't have any powers. They're just an encouraging, enabling force. So how we work, but we're working with the police should we want to do something.
It should be similar to street fasters that we have on in a number of places around the county to look after, well, basically to encourage people not to behave badly in the public domain, particularly youngsters in the evenings. It's that sort of role, isn't it? Sort of encourage people to do the right things, not the wrong things. Judith, do you have anything? Were you going to say something else, or is that it?
No, that's all. Just thank you, Simon.
Great. Ken.
Thank you, Chair. Just on Judith's point about the marshals, we are encouraging our CPSOs to ensure that distancing is adhered to. But also we have a bid in Basingstoke, and the bid rangers are taking that role on to direct some of the youth within Basingstoke to ensure that they get it, they don't congregate in greater number than 6, but also to remember social distancing is important. My point was about cheap and effective ways to remind people about it. And I don't know if any of you have been on the tube in the last few years, but many pregnant women use that baby on board badge, and it's an awareness thing, and perhaps there's a sticky thing that people could put out and just have wear that remind them of the 2 meters, remind them of social distancing, just so it's in people's minds as people walk around. And I know many of the elderly are concerned that they feel people are coming into their space and they feel a little bit intimidated by that. So something that's cheap and easy, like a sticker that we would normally have, might be a way of informing and not being heavy-handed in that communication to others.
That's really, really helpful. Actually, I'm really interested to hear a little bit more about the ranger role, because I hadn't quite connected to that. So I'll connect with your colleagues there. And you're right, we need to think of all sorts of methods. In the next piece I've got on comms, that's not included, but actually you're right. And I'm really pleased, as part of our test and trace grant, we have really increased our comms team's capacity, because it is really stretched. So actually we'll start to see more of this coming out, because we'll now have more capacity to do it. So I'll put that, I think they start on Monday, so I'm really pleased to get an extra pair of hands to support the comms, which, as we all say, is so key. But it's not in the next article, you hear what we've done.
Patricia. Microphone, Patricia.
Apologies. Thank you, Simon. I was very interested to hear what you have to say, but I think we will all agree that the secret of success is getting the message out, i.e. communications. All right. Now, what I'd like to ask you this afternoon is, I know that you've been having communications with schools, i.e. the teachers, but have you been having, or how are you planning to have more simplistic style communications with the actual young people themselves? And how, that's question one. And the second question is, how are you planning to communicate with the older young person, the 16, 17, 18-year-old? Now, I know you're going to say, well, through social media, because they all live on their phones. But some of them, shall we say, have issues, i.e. mental health issues. How are we planning to communicate, get the message through to that group of people?
Microphone, Simon.
Thank you. You're absolutely right. My next piece does show some of the comms. I'll just bring up some of these. So we have targeted areas for young adults across the piece in terms of communications, and particularly those with higher prevalence of coronavirus. And we have adverts and information on Snapchat, which was served up over 400,000 times, and there was 40,000 active views. So we're using the channels that they know and use. And please, I'm not a Snapchat expert at all, but I think, you know, with my colleagues in the team, we're doing those kind of things, working with and also working with the teachers to how to communicate with the children, because actually they're the best people. Teachers are, you know, really good at communicating. So we've worked with the teachers to communicate to the children in the schools. But you're right, it's a really key age group, which is why we're trying to use media such as Snapchat and make the kind of feeds relevant for them. But so that's how we're doing it.
And the older ones?
Oh, the oldest, so the Snapchat is targeted for 18 to 24-year-olds. But obviously anyone can access that.
Okay. Thank you.
Okay. Thanks for that. And your final performance, Simon. Communication engagement. We've obviously covered a bit of that already, but there's probably a bit more to say.
Yes, so there's two aspects to communication engagement. One is about swift communications in response to an incident or outbreak, and secondly about proactive prevention and the amplification of the NHS test and trace messages. So we continue to work with our LRF colleagues to make sure there's some consistency, and this is one of the highest, it is the highest priority for the council. So in terms of information, we're producing our weekly dashboard and sharing that across all the media channels as you'd expect, and doing regular briefings with key stakeholders. We did one this week on testing, including in the county newsletter and other parish county newsletters as well. And we're doing press releases regularly and social media messages. For high-risk settings and local businesses, we've done lots of flow charts and communications with businesses and high-risk settings to help them respond to a case of COVID, with the key communications messages and social distancing advice, including bespoke advice for adult social care provision, care homes, hostels and refuges. So we're doing all of that to make sure that's kind of relevant for them. In terms of prevention, I've just mentioned we've done some work with young adults. But also, you'll start to see an insight-led advertising campaign, including outdoor media, targeted paid-for work, such like the side of buses and things like that, to really get our messages out. We felt it was really important at this stage of the pandemic to really promote that. And then we're using our intelligence to target different ethnic communities in a way that's appropriate for them. And we've done some work on Facebook through that, because that was the most appropriate way we knew to target them through the insight work. And there was 74,000 views of that. And we've got, we have a platform to communicate further with these populations, taking that forward. In preparation for return to school, we did a lot of work with children's services to encourage parents to ensure that children did return to school, and that's been very successful using Facebook, Google Ads and the like. And there's also to reassure parents that schools are safe and had good measures. And this ran kind of in a short patch just before term and had 27,000 views. So we can see that we've got a number of ways of communicating online and in more traditional methods. And I can share this briefing after meeting, but we're using all the social media channels, Facebook, Instagram, Twitter, LinkedIn, and kind of using this brand of keeping Hampshire safe, such as behind me, to kind of do that and target those areas with higher rates to make sure that we can keep our communications fresh. So an awful lot of work going on, and I'm very much looking forward to having a little bit more capacity in that space to really target those messages even more in the next coming weeks and months. I'll stop there. That's my comms update from Deborah Harkin and Jane Bittler.
Thank you, Simon. Any questions on that last item? Are there any other general questions? Ken?
Sorry once again to keep asking questions. I have a number of issues. We've got a number of businesses going back to work, and the central government's drive to get people back in the workplace. I want to know how you're communicating with businesses. It's vital. We had the LEP meeting earlier this week, and for me, it's really important. There shouldn't be a sense of relief. Everybody's back and then get back to their old ways, but a sense that they are back in a different work environment with different rules and different procedures. I would like to know how you're dealing with that.
So through district colleagues and through our own ETE department, we have communicated with all the businesses, both on the new, for those that are public facing in terms of serving with the QR codes and the need for that, but we've written to all of them. I felt it was a worthwhile investment to spend the money on the stamps or the way we communicate to get the messages out to businesses. So we've done that. It's either happened this week or it's in train for early next week to do a big mail shot to all the businesses to encourage them, support them and thank them, really.
Okay.
Chair, if I may, can I have another bite of the cherry, if it's okay with you? Obviously, comms is really important, and sometimes it is down to a base level, such as parish councils who speak to their wider community all the time, and many parishes are now doing their meetings remotely and people are dialing into them. And is there something that could be said at the beginning of a meeting or throughout the meeting to encourage chairs to get that wider voice out of your public health message, and something that they can say to remind people that as the flu season ramps up, some of the community engagement that's already happened should be continuing?
We are communicating with town and parish councils, and there's quite a lot of work going on there. I wonder if I can just bring Laura Taylor in here, who probably Chief Executive of Winchester City Council, who can give some more ways of how she's communicating with towns and parishes and others.
Thank you, Simon. Thank you, Chair. Councillor Rattigan. On both of those issues, members, I sit on the Health Protection Board as the lead Chief Executive for the district councils in order to ensure we're working effectively in our two-tier system. And just as Councillor Rattigan has said, I know the districts are contacting businesses in different ways, through mail shots, through the bids, through local chambers of commerce, through direct mailing, through environmental health, through licensing visits. I know, for instance, the Winchester licensing team was out on Saturday night and visited every pub in the district to ensure social distancing was underway. And to make sure we have that in place, district chief execs meet on a fortnightly basis, and Simon has joined those meetings. So we're absolutely joined up in the public health messages that are coming from this board through to district councils, and we're distributing those out to our communities. Absolutely, Councillor Rattigan, parish councils are critical to that. And again, all of our district and borough councils are in contact with parishes. Winchester, for example, in that we have resent the advice for managing community halls out of our district this week. So we very much rely on that flow of information, using the branding created by the county council and personalised for each district or borough for distribution on. But I'm sure there would be some words that we would all distribute in our, we call it in Winchester, our Parish Connect, for some public health messages for parish and local council chairmen to share at the beginning of the meeting. And Simon merely needs to give that to me, and that will be distributed within the week.
I'll do that.
Laura, thank you very much.
I'm grateful for that, Laura. Thank you very much, and thank you, Simon.
Actually, following up on Ken's point, got me thinking. We probably already do this, but clearly with the business community, it's a matter of liaising with people like the chambers of commerce and the other local business organisations. Like in my area, there's a business partnership in the New Forest, and of course there's a number of regional trade associations. Again, the one I'm most aware of is the one in aerospace that covers the whole of the county, which is the Farnborough Aerospace Consortium, which has a direct link to an awful lot of relatively small firms in aviation and aerospace in our area. So it may well be that we need to think about those institutions existing within the business community that can do some of the work for us because they're in contact with all their members. I don't know whether we can think about that.
I can check with, I mean, we've done a lot of communication. Public health, my expertise, not the business bit, but I do know colleagues who've done that, but I don't quite know the details of how they've done it, but I can check.
Certainly if we contacted, obviously, the organiser, it's worth having a word with David Fletcher because he's got a very long database.
Yes, that's who we talk to, yeah.
And the two LEPs should actually also now increasingly have quite a lot of these individuals. Good, yeah. Okay, Judith, did you have a question? I saw your hand flick up very quickly. And you've obviously remembered to switch your microphone on.
Yes, but not anymore because it was answered. Thank you.
Good. Okay, that's great. Fine. Well, I think we're just reaching the end of this meeting. I don't think there's. Has anyone got any more general things they want to ask before I close the meeting? I'd say two things finally. First of all, we're obviously going to meet next month. Have we got a date for next month at all, Samira?
We do. Let me just check. It will be 6th October and then 2nd November are the next two meetings.
Thanks very much indeed. Ken, you had a point.
Thank you, Chair. I know it's a local issue, but we've had pressure on your Chief Executive for a decision to move the mortuary towards Basingstoke. I just want to know, firstly, I want to say when he's not in the meeting, he has my complete support on the decision-making process, but also how we are going to engage with MPs, because we've got all of them and we've got quite a number who are vocal, to make sure that they, not in the process of making the decision, but they are informed as quickly as possible when a decision is made. I think it is vital that, I mean, the hours that John has spent firing back emails is ridiculous, and we need to find a way to stop that at the beginning.
Yeah, probably I can answer that. I think, like everything else, I think during August was probably a lot of people were away, and probably we weren't communicating as well as we might have done in certain circumstances. It's always quite difficult to know exactly what to provide and what not to provide. We obviously have the regular system of communication with MPs that goes out at regular intervals. In fact, I've just sent another note out covering the latest developments in the pandemic. But I think you make a good point, Ken, and thank you for your support in the particular instance that we were talking about. And I think all we're going to do is learn the lesson from that we need to probably be rather more careful about those things that MPs are likely to get quizzed on by their own constituents. I thought we covered most things, but in this case we probably didn't. So it's a point well made. Before we close, having decided the lull and when the next meetings are, I'd just like to make the point that clearly still this particular pandemic moves quickly and in directions that we weren't always aware of. And therefore, if there is any need for us to meet more frequently, we'll arrange that. And we've got a procedure in place where we don't have to go through the normal process of publicising things at regular intervals before the meetings take place themselves. So we have the ability to call what I would call a briefing session for this group, which we can simply hold literally within hours, if not a day or two. And that, I think, is a useful facility to have so that we can react quickly to any changes that occur, as have done in the Northwest and the Northeast. And also we can provide as much support as we can for Simon, who's normally at the coalface, as it were, on most of what we do. And therefore, we'll obviously meet in another month's time, or just less than a month now. But if there's anything before that, I will simply press the button and we'll have a meeting online to discuss the particular matter in hand. Anyway, thank you all very much. Have a good weekend and see you all next month, if not before.
Thank you very much.
Cheers.